We take care of patients with hematologic malignancies, which are cancers of the bone marrow, blood, and lymph nodes.
Our BMT program here at UT Southwestern takes care of patients from diagnosis through transplant, through long-term maintenance therapy.
Most of the allogeneic stem cell transplant doctors are not only the hematologists or oncologists for their patients, they're also their primary care doctors. You get to take care of the patient as a whole.
We see more than 700 new patients a year, do well over 100 transplants a year. But it's not so huge to where you just sort of lose touch of the patient. They will not get better care anywhere.
The environment when you come in is positive, from the attending physicians, your nurses, all the way to every staff member you will encounter.
When one of our patients meet with us for the first time, they come to the clinic, we want to make sure that they're completely set up for success through their treatment. They meet with a lot of disciplines that day and get to know everybody.
We discuss every single new patient who's come into the system as a team. The first thing is making sure that we get the diagnosis right. And with that information together, then you know what the right therapy is going to be.
There'll be the main physician that's in charge of their care, but that physician also works with a team of nurses and physician assistants, pharmacists that also help make sure the patient gets all their care needs met.
Patients will vary along the spectrum in terms of what their disease is going to behave like and what their treatment's going to be like. One approach might be very watchful waiting, we call it. Basically just make sure that we're supporting them and that we're not giving them potentially toxic therapy. Another common track might be patients who are getting standard chemotherapy and immunotherapy. There are some patients who have very aggressive cancers that can only be cured by very aggressive treatments. That can include bone marrow transplantation.
Based on the patient's disease, the physician will decide which type of transplant the patient needs. Autologous using their own cells versus allogeneic using donor cells.
We look at patients' siblings typically as our first step. And then if they don't have a sibling match or they don't have any siblings for us to test, then we will look in the National Marrow Donor Registry and search for an unrelated donor.
For the actual transplant, our patients will then admit to the hospital and receive high-dose chemotherapy to prepare their bodies to receive their cells back.
I love you, baby.
Everything is about the patient, and the building was designed with the patient in mind. It was designed to make it quiet. There's a physical fitness room that they can use along with our physical therapists to sort of keep in shape.
Really large, beautiful rooms, a lot of light. When a patient has to be in a hospital room for 4 weeks, those things make a big difference.
UT Southwestern is NCCN designated cancer center.
This is a fantastic research institution, so we're really plugged into a lot of great research programs, and we're able to bring that to the patient.
And with the onset of stem cell transplant, we are seeing cure rates in the 60 to 90% range.
With CAR T-cell therapy, we're taking the patient's immune cells called T cells. We're inserting a gene and it causes them to attack those cancer cells.
I still see patients that had a transplant 10 years ago that I still know them by their first name. They know me by my first name, and it's really exciting to see them.
You come here, you see familiar faces all the time, and that adds a lot to the comfort level during your course of treatment.
It's highly rewarding to see the outcomes that we're seeing in multiple myeloma and other blood cancers. We're seeing patients live longer than ever. We're seeing higher quality of lives.
And every single one of those patients at some time heard someone utter the words that they had leukemia or lymphoma. To take a patient who's in that sort of a position, deliver the best therapy possible, and then see that patient 10, 15 years down the line, what a wonderful thing that is. We are completely devoted to your care, and we'll give you your best shot at getting through this really difficult time.